with our special guest, Mr. Andrae Bailey, the founder and CEO of Project Opioid. Welcome, Andrae. Thank you for joining us.
Dr. Ward, Babette, thanks so much for having me on this special show to talk about these important issues.
Andrae, can you tell me why you started Project Opioid?
Absolutely. You know, about 2 years ago, I was approached by some of my friends at Florida Blue, the big insurance company here in our state. And they just kind of presented to me this incredible overdose crisis that was happening in Central Florida. And Babette and Kendall, I will tell you, I didn't know a lot about it. I'm like a lot of the listeners right now on Real Radio 104.1 who are hearing about this overdose crisis. We're talking about all these young people taking these deadly drugs and dying all around us. And there's people out there listening going, wow, I didn't even know this was happening. I was one of those folks who didn't know a lot about this crisis. But when I was presented with the facts, and the facts were that just massive amounts of our community members were struggling with opioids. Many of them have gotten addicted to opioids by prescriptions from their doctor. I know a lot of folks have heard this story already, but you know, the story of Purdue Pharma and decades of overprescribing, doctors overprescribing drugs. And so I heard this story, and I heard from some of our partners at Florida Blue that we really needed to do, you know, what I had done in the past, which is build a collaborative of business leaders, faith leaders, nonprofit folks like yourself, Babette, courageous elected officials, folks who want to get off the sidelines and make a difference. And they said, would you help us build a collaborative on this? And I said, absolutely. And so in 2018, Tony Jenkins and I, regional president for Florida Blue, set out and started Project Opioid and began meeting with leaders throughout Central Florida and saying, hey, there are way too many young people, people of all ages, but a lot of young people struggling with these drugs and dying in record numbers. So I built Project Opioid, and then little did I know 2020 would hit. And as you guys are probably talking about often on this show, 2020 has brought to our community, our state, and our nation the largest increase in substance use, alcohol, but also deadly drugs like opioids and fentanyl. We've seen the largest increase in our community, state, nation's history in 2020. And we've seen the death rate, which was already just almost unthinkable, skyrocket to even higher levels. And so, I started Project Opioid in 2018. And now, thank goodness that our leaders did come together, because there's a lot of work to be done, because far too many people are dying right now in our community. And I'm so thankful for Babette Aspire. They're doing great work. And I'm thankful also that folks who are out there listening, they're hearing many of them about this for the first time. Many of them might want to get involved in this work and how they can help their community. But there's a lot of folks listening, as soon as they hear us talking about overdosing and opioids, they get that cold chill, the hair on their arms stand up, because they or a family member's in danger. So I'm glad Aspire is a part of Prescription for Change Radio, because they can offer people help right now if they're struggling. And so that's very exciting.
That is so true, Andrae. And let me give everybody a number that they can reach out to if they need help. I think Andrae makes some excellent points about people reaching out for the help. If you reach out to 407-875-3700, there'll be somebody there to help you or your loved one. Please reach out for that help. Andrae, you've made some great points, and involving the business community, I think that's really intriguing for me and for listeners as to why you started with the business community, because we know that within our world and looking at what happens, there's stigmas associated with people who are addicted to opioids or other drugs. Can you expand a little bit upon that?
Sure. I think Project Opioid decided in the very beginning that we had to get business leaders involved, because business leaders often, look at problems, challenges like this overdose crisis. I think they look at it through a different lens, and they say, hey, what can we do to really make a difference and get more people help. They bring an accountability when they come at it from the right heart. They bring a real accountability and push government. I know I sound anti-government on this 104.1 radio station. I am not anti-government. Not my little disclaimer here. Not everything is political, but I would tell you I've done this work on a community. Working with leaders in communities to try to impact issues. Gosh, I'm getting old, guys. About 20 years I've done this work, and I'll tell you, government by itself just struggles to solve these issues. It does. And so business leaders are great because they can come in, you get them educated. They don't know what in the heck they're talking about when you first, get them involved in an issue like this most of the time. But you get them educated and boy, turn them loose and they can really make incredible impact. So business leaders are important. I'll also say though, that I was shocked at how many business leaders, faith leaders, philanthropists, others had a personal experience with a family member or someone they knew who was struggling with these dangerous drugs, and even someone who had overdosed or died. Kim Lopdrop, who is the CEO of Red Lobster, they're located right here in downtown Orlando. He's the co-chair of Project Opioid. I remember him, Tony Jenkins and I meeting with him for breakfast a couple of years ago and saying, hey, Kim, we want you to be involved in this new initiative we're doing to help people who are struggling with opioids and who might overdose and die. And he said, I'm in. Like before we even got to the croissants at breakfast, he's like, I'm in. And he told us 3 stories of people he personally knew. One of his best friends, Rick Van Warner, whose son had struggled with opioids for years, had been in and out of treatment. They had spent their life savings trying to help him. He told me that story. And then he told me the story of a person that he had invested money into a company. This was an Elon Musk type entrepreneur running a big company, who Kim got a call one day about a year earlier, 2 years ago, a year earlier, so 3 years ago, that this guy had just suddenly died. He was like 51 years old. Kim found out he had been secretly taking opioids and got a fatal illegal dose of fentanyl and died. So Kim had stories of people he knew, and it's not surprising because so many people, we get on this radio station, every time I hear you ladies get on Saturday morning and start talking about this overdose crisis, I know it resonates with so many people listening who are struggling or who know someone who's struggling. So business leaders are critical, and we need them because they can cut through the red tape and try to get help for people in need.
And you bring up a great point, Andrae, that really this is a cross-cutting issue. This is not the overdose initiative. The overdose epidemic isn't confined to a certain race or ethnicity, a certain socioeconomic status. This is really pervasive across our community. So what would you say to someone who is struggling? What should they do?
Yeah, I would just say this. If you're out there and you're struggling, number one, just know that you have a community that cares about you, that loves you. You don't have to feel bad about yourself. You don't have to feel judged. Trust me, man, I know how it is to struggle and to have, things that you're not proud of and things that you wish could be different about yourself. And you're out there listening, or you have a family member who's struggling. You feel ashamed. You don't want to talk to anybody. But at the same time, you're out there struggling with these drugs. You're in danger. You know when you're in danger. And I would just say, don't be ashamed to reach out and get help. Don't be ashamed to talk to some folks at Aspire or another agency in town or another group in town. And I would also just say this, these drugs are going to kill you, man. These drugs, it's not, Kendall and Babette, it's not like it was 5 years ago, 6 years ago, before fentanyl came on the scene. We hear so many stories about Houston, a guy that works for Project Opioid right now. Houston struggled with heroin and oxy for years. and got clean in like 2014, right before fentanyl came on the scene. And his story is he relapsed and then got in treatment and relapsed and got in treatment. If you're out there listening, you're one relapse, you're one bad pill, bad dose away from death, and your family needs you. And so anyways, we're not here to preach at you, but I would tell you, reach out and get help. There's so much
I
help
think
for
you make
you.
such a great point, Andre, that people relapse because this is a disease. We know that it affects the brain, that people continue to really seek out the drugs. There are ways to help people to overcome that addiction, but certainly it does impact the brain. You know, you have created and dedicated your life cause to helping people. And many times you've seen behind that certain statistics as to what is happening. I know through Project Opioid that you've been looking and trying to get out really from a statistical standpoint what's happening. Could you let our listeners know what we're seeing today as a result of the pandemic and the opioid crisis coming together?
Yeah, and Babette, I think you could also speak to just this incredible volume of people who have been reaching out during 2020. Aspire, for those of you that don't know, that agency is the largest behavioral health group in the region. And so they get a lot of resources and have a lot of partners for mental health, substance abuse, all kinds of issues. So the hotline that you're calling when you hear that number is her hotline. And so they're kind of ground zero, Babette. You've been ground zero in 2020
Absolutely.
for the amount of calls and emails that have come in. And so, I'll be flipping back to you. What are the numbers, any number that you can think of from 2019, 2020 increase?
Talk about some numbers of what's happened, because I want to tell our listeners you're not alone. People are reaching out for help, as difficult as it might be. Our hotline had increased in a 5-month period from a year prior to today with over 100,000 new calls for service.
Wow.
Amazing.
Our medication assisted clinic a year ago had 150 patients. We're over 800 patients today, and every day doing additional intakes because people understand they need help. As Andre indicated, and you've heard others that have come on the show talk about, what's out there right now is extremely potent, and then laced with fentanyl, people are dying. And you're too important for that to happen to you. You can make a difference in this world, and you need to be able to reach out for that help. Let somebody know. So a friend, law enforcement, if you reach out to law enforcement under Good Samaritan, nothing's going to happen to you other than you get the help that you need. And then there's people in the business community, as you hear through Project Opioid, that are here to assist you and to help you get into the services that you want to have and want to need.
And I think it's important to point out that even during the pandemic, you can still get services without
Absolutely.
going in to a facility.
Absolutely. Great point, Kendall. Through a telehealth environment, you're able to get services, either telemedicine, telepsych, telecounseling, and even case management. So a reach out means somebody will be responding to you to link you into the services that you need and that you deserve in this community so that you can beat that addiction.
Wild, because if someone's, again, out there listening and they're on the other side of this conversation, they don't know anyone who struggled with opioids. They don't struggle with any kind of drug that could make you overdose and die. I'll tell you, it's so easy to be judgmental, right, when you don't understand the power of these drugs. And so that's why I have a master's degree in divinity. I actually I swear a lot, but I went to Bible school. I tell you, it's true. And but I know what it's like to be in the faith community and to fall back. It's just so easy to fall back. Faith leaders, sometimes business leaders, people who have this kind of conservative mindset like I do at times. It's just so easy to judge someone who's struggling with a substance, maybe alcohol or drugs or opioids. And I'll just tell you, if you're someone who's out there and, maybe you do know someone who's struggling with opioids and you're like, man, they just need to get tougher. They need to suck it up and stop doing that bad behavior, just quit cold turkey. I will tell you this. Quitting opioids, if you've been taking them for any amount of time, is not like quitting carbohydrates. It's not like not eating pizza and potato chips. These drugs are powerful. They connect with the receptors, the pleasure receptors in your brain. And I'll tell you this, if someone's been taking these drugs at any quantity, 3 months, 6 months, a year, they've moved on maybe to these illegal drugs like heroin and fentanyl, they cannot quit. A lot of these folks cannot quit without treatment. They're no longer even, but you see a lot of people in your clinics, they're not even taking these opioids anymore to get high. They're taking them because if you don't take opioids and you have a physical dependency every 8 hours, you become physically sick. There's a term called dope sickness where you can't even function. You'll begin violently vomiting and have seizures. And so people need to understand that, it is so, addiction is a disease of the brain. And I agree with that. But when you're on opioids and you have a physical dependency, boy, it's another level of these weaponized drugs that you're gonna need help to get off these drugs, in my opinion. It's hard to just go cold turkey.
Something you said previously about the faith community, because you included the faith community in Project Opioid, and there is so much of that community that believes that you should be able to just pull yourself up. And we've talked to Pastor Joel Hunter, who shared such a great story the last time he was here. Why did you feel it was appropriate to include the faith community? And what would you say to somebody who's kind of struggling with getting help out with their faith?
Boy, if you go to a church, there's still a lot of people in our community and our society that go to a community of faith. If you go to your church, you go to your synagogue, and the guy, the gal standing up at the podium has a message of love and grace for people who struggle with these kind of mental health issues. Oh my goodness, mental health it's tragically, it breaks my heart to even talk about how we judge and offer ridiculous, solutions or lack thereof solutions for people who have mental health issues that they cannot control. They have no power over many times, the anxiety, the depression, or if you take it up a level, some folks have bipolar schizophrenia or these clinically medical conditions of the brain that are so far beyond their control. And addiction, we don't want to hear this, but many times addiction's just like that. It's something that certain people struggle with in ways other people don't. So when a faith leader gets up in front of the podium and offers you grace and hope, and maybe this is crazy, but maybe even says, hey, listen, go talk to Pastor Bob back there at the end of this service. Pastor Bob's going to talk to you about some programs we can help you get connected with that can get you counseling, maybe get you medication that can help you. By the way, if you're out there listening right now and you keep hearing us talk about MAT and we talk in these big acronyms that you don't understand, here's the simple version of what medication-assisted treatment is. The simple version is, in the same way that science is going to beat COVID-19. If you look at COVID-19 finally starting to, recede a little bit, we're seeing a little drop. And by the end of this year, it's not going to be well wishes and hope that beat COVID-19. It's going to be science. The vaccine, 90% effective, and we're rolling these vaccines out. And a lot of people out there, anti-vaxxers, and don't want to take a vaccine. By the way, take your vaccine. Get a vaccine. You need a vaccine. But I will tell you, in the same way that science offered us just a complete solution, or a solution that's going to get us hopefully back to normal in the next few months through FDA approved medicines, vaccines. A lot of people don't know this, but there are FDA approved medicines for people struggling with overdose. There are medicines that you can get from a clinic like Aspire has, or other partners, or maybe even from your local medical doctor provider, your family care physician, if they have certain certifications. There's medicine that you can take, that medicine will create, it's not perfect, but it'll create a layer of protection from overdose. It'll help you, on this journey to get off these drugs if you're out there struggling. And so people need to know, faith leaders, business leaders can just be such a great front line if someone's struggling. If people who are out there listening, if they can reach out and get help before those drugs really start destroying their life, that's the best option. And the faith community and business leaders through their HR department, Kim Lopdrup, again, bragging on this guy, the CEO of Red Lobster, he put out a video to 67,000 Red Lobster employees about 6 months, a year ago, and just told all of them, listen, if you're struggling with opioids, we're not going to fire you. Call your HR department, talk to someone in management. We want to get you help. A message like that from your faith leader or your business community leader absolutely can be transformational, because it sets you on a path to know that getting help is something that's available for you and that people important to you want you to seek.
I think that's a really important point, because people can be suffering from addiction and still function, right? I mean, can someone still be going to work and school and everything?
My father, I'll tell you this, my father was a vicious, terrible alcoholic. I mean, this is, I think maybe going all the way back to the first question asked, I think although I do not have tremendous experience with opioids, I saw addiction and how it can just be just so pervasive and destroy families and destroy people's lives. My father struggled with alcohol his entire life, but he was amazing at work. He worked for a local company that had thousands of employees over a 20-year period of time. He was like employee of the year twice, but then he would come home and alcohol ruled his life and ruined his life and took from him so many of the great things that his life could have had, relationships and great future that he could have had. And it took his life early. So I'll tell you, Kendall, absolutely people can struggle with these drugs. Nobody know. But can I tell you, here's one difference. You're out there and you or a family member, if you're messing around with opioids right now, it's not like it used to be. Right. Whether it's cocaine or whether you think you're taking oxy pills you're buying on the street. Guys, ladies out there, you're buying fentanyl. Fentanyl is in everything now, and fentanyl is a killer. It is so powerful and it is so deadly. And Kendall and Babette, you know this. The people that are dying, they're dying of fentanyl, and fentanyl's brand new. For those of you out there who you're not in, you don't know a lot about drugs. You got a kid who's struggling with these drugs. You're a mom. You're like, oh, it's a phase. They'll get over it. Hey, mom, guess what? It ain't like what it was before. Right. Fentanyl, this illicit drug that the ingredients come from China. The Mexican cartels are making these fake fentanyl, Oxycontin pills that filled with fentanyl. These drugs kill you in an instant. And so people can't look at this crisis the way they looked at it before. Almost every day, Kendall, you're on these email and text loops. We see a story of some young person that died, a famous person, an actor, a sports athlete, and we go like, and they don't, and at first they don't ever release the cause of death, right? And then we text it in our group and go, opioids, fentanyl, or suicide. Like sometimes it's suicide, but fentanyl is killing people, and it doesn't allow folks. Again, I just not to go back on this too many times, but I think of my father's struggle with alcohol over 30 years of his life. Fentanyl will never allow that to happen. Right. You will be dead in a short. It's Russian roulette. You're playing Russian roulette every time you put one of those pills in your mouth. Every time you take heroin or do cocaine now, crack cocaine, they're putting fentanyl in crack cocaine. So people, if you're struggling, someone struggling, you got to get help, because you never know if your next dose is your last dose,
Right.
because you're going to overdose and die.
Andrae, I want to go back to a couple of things that you said, because I think bringing in the business and faith community is super important. And what that does is it brings advocacy and education to what's happening. But you also really talked about the lethality that we're seeing of the fentanyl and overdoses. I think for our listeners, it would be really important for them to understand, because going back to how you started this is you didn't know a whole lot about what was happening with opioids and the opioid crisis. And there's something out there that can help people in addition to medication-assisted treatment, Narcan. And I'm of the belief, being the CEO of the largest behavioral healthcare company here in this area, that everybody should have Narcan in their hand.
Yes.
Would you like to share from your perspective where and what Narcan can do to help save lives?
Narcan is saving more. If you've never heard of Narcan, you need to get some Narcan. Narcan is a drug that should be in every person's home. It should be in every business, every church. It's just a small little container. What is what is the clinical name of Narcan again?
Naloxone.
Naloxone. I don't know why I couldn't remember that this moment. So naloxone is the actual drug. Its published name is Narcan. But Narcan is just a small little dispenser with clear fluid in it that you press the pump, and it shoots it into that. Kendall's got it in her hand right there. It shoots a dose of this naloxone into someone's nose, and it's amazing. It counteracts what happens when you overdose. A lot of people don't know this. I didn't know this. When you overdose, what actually happens to you is that, the opioids, and Babette will clean this up if I say it wrong, but the opioids basically interact with the receptors in your brain, and they slow your breathing, and they calm you, and they relieve pain, and they have this euphoric effect. The problem is, past a certain dosage, they impact those receptors in a way that doesn't just slow your breathing, it stops your breathing. So an overdose on an opioid is terrible, because you actually suffocate to death, because your lungs are being told by your brain, hey, stop working. Hey, it's cool, man, just stop breathing. What Narcan does is that injection of Narcan, it goes straight to your brain, and it counteracts that signal that the opioid is sending to those receptors. It's more powerful than those signals, and it boots them off the receptors and says, no, get out of here. And as soon as those opioids don't have the ability to interact with those receptors, you start breathing again. It brings you back.
And if you are at risk of overdose, or someone in your circle is at risk of overdose, you can actually request free Narcan from the Project Opioid website. It's a very short little form to fill out, and we will mail you Narcan free of charge. All we ask is that if you use it, that you let us know, so that we can report back to the state how many lives we've saved. But Narcan is a really important tool that can be used.
And you shouldn't be afraid to use it, because if somebody you believe is overdosing and you use it and they're not actually overdosing, it's not going to hurt them.
It's important that people know Narcan is safe. If your kid got a hold of it, if someone, ingested it accidentally playing around, nothing's going to happen.
Right.
It's amazing. Technology is amazing, right? Medical advancement is amazing. It only works if you have opioids in your system, and it only works to interact with those opioids on the receptors of your brain. And if you don't have opioids in your system, it doesn't do anything. So Narcan, we need to get Narcan out everywhere. Narcan is saving thousands of lives in this community, around the state, around America. I also think Narcan sends a really good message when you have it in your home, when you have it in your office, when you have it at your church. It's a message that we're finding solutions to help people.
Absolutely.
We're not looking to judge people, and listen, anyone can struggle with a substance.
So let me ask you this: pandemic, opioid crisis getting worse. What does 2021 look like?
Oh, I think 2021 is going to be a really challenging year. There's a lot of data we have just been looking at on suicides. I know this is kind of a different topic, but suicides apparently were down big in 2020. And the data, Babette, says this, that suicides were down in 2020 because often during a crisis, people will, they will cope, they'll get through it. But when the crisis is over or there's some level of ending or relief, that's when the devastating impact, the mental health impact of that crisis really begins to show itself. I mean, for a lot of folks right now, it's been 2020 was such a traumatic year. We had the pandemic, COVID-19. Politics was terrible. I don't care if you're a Republican, Democrat, whoever you are, politics was so horrible and negative and just heartbreaking for everyone in 2020. It dominated our lives. And topics like the social justice movement, so important, but also topics filled with so much emotion. We were strained emotionally. Every person in Central Florida, across America, we were strained in ways we've never been strained before. And you mark my words, in the next few months, as COVID vaccines get out there, and as all the politics hopefully turns away from where it was to where it's going, we're looking at each other going, okay, time to just get back to life. And for so many people, Babette, they're going to struggle to do that. And I think you're going to see, unfortunately, suicide rates rise, and alcohol consumption, drug consumption, all these different addictions are skyrocketing. They have not gone down in 2020 going into 2021. And I think that means, unfortunately, that from all the data we've seen, the overdoses, people taking opioids, people taking related substances, I think we're going to see the greatest mental health crisis in the history of America in 2021. That sucks. I hate that that's true. But by the way, I say that, and people listening are like, you don't have to tell me, man. Like I'm struggling. My family's struggling. It's the amount of people struggling right now I've never seen anything like it in my life. And if you have some kind of inroad to opioids, overdose related drugs, those inroads could lead you to certain death. So I think we're going to need more resources than ever. We're going to need more leaders to take on this cause than ever. And so we're really thankful for all the leaders involved in Project Opioid.
To Andre's point, if you need help, whether it be for addiction or you're suffering from anxiety, depression, some mental health issues, please reach out to Aspire at 407-875-3700, or your private practitioner or somebody else. Just reach out for that help to somebody, because people care about you and they're here to help you.
Yeah, and don't stop. If you have a family member you're trying to get help for, do not stop until you get help. Listen, Andrae Bailey, Kendall Ward, Babette Hankey, find us. I'm on LinkedIn. I'm the easiest person to find alive. Email me. If you're out there and you can't get help, call me, text me, email me. Do not stop until you get help.
Absolutely.
This is life or death, and this community wants to help you. But at the same time, I'll tell you, I think this community, every community in Florida, around America, is overwhelmed with the amount of people in need. And so, don't be afraid to push on us, push on all those in the community who are supposed to be helping you or your family. Get help, and do not take no for an answer.
Yeah, absolutely. I think that is exactly what we're trying to get across to our listeners, is that we are here to help as individuals, as Project Opioid, as Aspire. There are resources. Your community does care about you and wants to help. So Aspire has a wealth of resources available. Project Opioid's got resources on our webpage.
Absolutely. We're here for you. Please reach out. We'll be here to support you. As Andrae indicated, if you can't get through to anybody, reach out to one of the three of us.
So Andrae, we're just our last little bit of time. I'm just going to ask you one more time. We know that people are suffering. 2020 was tough. 2021 is not shaping up to be much better off the block. So tell us, what is the one thing you would say to a person that's at risk for overdose, their friends, their family? What is the one thing that you can say in closing?
Well, I'll say this. If you're someone, and we've said it over and over and over again, and we can't say it enough, if you or a family member are struggling with a drug that causes overdose, if you're struggling with anything, get help. Like, get help. You don't even have to leave your house. You can just get on the internet and have a telehealth, behavioral health counselor talk to you via the internet. So if you're struggling, get help, get yourself right. If you're struggling with a drug that can cause overdose, like opioids, listen, man, you're not trying to die. You're not out there trying to die. Don't die because of the struggle you're having right now with that substance. But you're gonna die. Like, there's people out there, you're listening to this, you're struggling with opioids, you're struggling with heroin, you are going to die. You're gonna leave your family and those that love you. You're gonna leave them alone in this world, and they need you. Reach out and get help. Reach out today. Don't wait. And the last thing I would say is, if you're a business leader out there, you're a church faith leader, you're an elected official, you're someone who maybe you're not struggling with these drugs, but you're listening to this today, and for the first time you're hearing about this crisis, get off your beep. And that was me censoring myself. Get involved with this crisis. We need you. Get involved with Project Opioid. We need leaders. Project Opioid is only successful if it has leaders like Kendall and Babette and other business leaders and faith leaders. Without them, there would be no Project Opioid. So if you're out there listening, get involved. Contact us at projectopioid.org. I'm Andrae Bailey. You can email me. Don't sit on the sidelines as a record amount of our neighbors and friends die every day. Get involved and do something. And by the way, when you reach out and make a difference in someone else's life, I've found if you're down and out, if you're not feeling good, sometimes the easiest remedy is to do something meaningful for other people. So that's my advice. Get involved or get help. But together we can save lives and transform lives in this community.
Wonderful. Thank you so much, Andrae. That was such a great closing.
Thank you for your passion and your commitment to our community.